Hey everyone, my name's Earl and I'm the urology nurse here at the Pure Clinic. I'm the rounding nurse in the hospital, and today I'm here to talk to you about bladder scanning. We have all the nurses in the MA's bladder scan, whether in the office or in the hospital, but how many of us actually do it correctly? And I have my volunteer here, Miss Ayel. He's going to help me out here. He's drank a ton of water this morning, so we're going to see how much is in him. So the first thing I want to talk about, though, is bladder scanning. So I know a lot of nurses on the floor have gotten orders to bladder scan a patient, but let's go over the terminology first, because there's two types of bladder scans that I typically want to see. It's either a random bladder scan, like if a patient can't urinate at all, then you just bladder scan them. But really what we're looking for most of the time is what's called a post-void residual. In other words, you've got to give the patient a chance to pee first. If you don't give them a chance to pee and just cath them, well, that's not good. That can introduce infections, and you don't really give the patient a chance to pee at all anyway. So before you bladder scan anybody, typically I want them to at least have a chance at peeing. And it's best if you can get them up and out of the bed, not on the bedpan, not peeing in the bed, but if you can, get them out of the bed, because gravity can help us stimulate that urge to pee. And a lot of people, men and women, can pee easier when they're actually standing up or at least sitting on the toilet versus the bed. So again, random bladder scan, you just scan them at any time and see what the number is, but more often than not, we want what's called a post-void residual, after they pee. So remember those two terms. So when I started up on the floor, nobody showed me how to properly bladder scan anybody, and they just said, put the wand on the belly and pull the trigger. Well, I actually learned how to do it the right way according to the bladder scanner by looking at the video on it. So today we have obviously different models of bladder scanners, and the two that we have in the office, we have an older one, and then we have this Bladder Scan Prime Plus. So this one's kind of fancy. It has a nice looking screen here, so we're going to go ahead and try to use this. But one of the things I want to show you is to use it the correct way. If you want to watch the video, you see the help right there. You press on the help, and it's going to show you a little video of actually how to do it properly. That's how I learned to use it properly. So make sure you go through this video so you're doing it the correct way. Let's see if we can get out of that. Okay. All right, so this is the main screen. Now we're going to scan Miss Ayel here. All right, so the first thing we're going to do is put a bunch of gel on his belly. Now I already have some on there, so I'm just going to put a little bit more here. And typically it's about a little over an inch above the pubic bone. Okay. Now this scanner, if you look again here, it has this checked off because I'm going to be on the patient's right side. But if you're on the left side, you actually press this button right here, and you can see there's a person laying on there, and you should be on the correct side to get the most accurate scan. So we're going to put this on his belly now. I kind of move that gel around, and then I press the button on the side. Now I know it's kind of hard to see here, but let's see if I can show you this way. If you notice, let me get this up here. If you notice, we can see his bladder, that round kind of oblong black area. That's his bladder, and that's where the urine is. So we want to get that centered before we push the button again. So let me get that centered. Okay, and it's not a bad reading, a little bit low, but you can see he's retaining more than 527 cc's of urine. And what we want urology to do also is to get that as centered as possible. Now this isn't a bad scan, but usually I like to scan them several times to kind of get an average of what's going on there, because sometimes a single scan can be off. So I'm going to scan them again. I'm going to get it centered. Okay, and it's a little bit low again, but about 525, so I know they're pretty all in the same area. Let's see if we can do it one more time and see if I can get a slightly better scan by tilting it up some. Okay, and there you go. That's a better scan. As you can see, as it's more centered, it's green also now, and we got 602, so that's quite a bit. So he's retaining. So next for Miss Ayel, we'll be putting in a catheter. No, I'm just kidding. No catheter for him. Okay, so some of the things you don't do, and these are the things I've actually seen on the floor. I've seen Techs and nurses scan like this. They're moving that wand all around. I'm not sure what they're trying to accomplish, but maybe they're trying to see, check the whole belly, but that is not how you scan someone. You find the place that it's supposed to be in and you scan them. So I'm just gonna do an off scan one time here. So as you can see, I'm intentionally tilting it sideways, okay? And it's close to what we got, but you can see it's still not accurate. So again, we want to try to get that centered as much as possible. Okay, so once we got a few good readings, then I kind of record those and kind of take the average. So that's how I know how much is in him. All right, so, and that's how you bladder scan somebody with the Bladder Scan Prime Plus. Okay, so on right now, let's wipe all this stuff up.